Hello, everybody. My name is Nia Kamara. Thank you very much for this opportunity, for permitting me to present on malaria on this subject matter. The title of my presentation is Strengthening Community Resilience, Malaria Prevention. Once again, I would like to thank you and welcome you all to my presentation. We will start out by discussing the main purpose of this presentation, which is the introduction. This presentation and this intervention is centered on malaria and alleviating the burden of malaria on a small West African country, Sierra Leone. It is my home nation, so I'm very passionate about the presentation, hence why I did decide to choose the community as the target population. But malaria is a life threatening disease and it is transmitted by mosquitoes to humans. It is a disease with a global burden resulting in 282 million cases and 610,000 deaths globally in 2024 alone. Unfortunately, though it does have such a heavy burden, most of it is concentrated on the western coast of Africa, as West Africa bears a disproportionately high share of the global malaria burden. And this is due to a combination of tropical climates and economic challenges. The tropical climates happen to create location and vector sources that are breeding grounds for malaria transmission. Therefore, the malaria and its proportions that are currently in Sierra Leone are endemic proportions, which is posing a public health challenge, and it is currently a leading cause of morbidity and mortality in the country. Like I did previously mention, malaria is a climate sensitive vector borne disease. So, therefore, climate variability definitely affects malaria transmission. Precipitation in certain locations are crucial factors that do create breeding sites for malaria. As well as it is also fueled by socioeconomic challenges, such as poverty, poor housing infrastructure, low education, low awareness on malaria as a disease, transmission and mitigative factors are poorly understood. And of course, inadequate healthcare access and infrastructure do not support the current population and allow something that is already so detrimental to have more of a devastating effect on a community. And of course, one of the other factors is the fact that poor health literacy on malaria transmission and for preventative measures sure create a driving force in terms of the expansion of the disease as a whole. The proposed intervention, it is centered around community resilience, and increasing the knowledge base on malaria, as well as disseminating long-lasting insecticide-treated bed nets. This intervention, it has been proven to be effective, and it is a scalable strategy for preventing malaria. And then, of course, in accordance to the bed nets, the educational campaign as well, it is meant to coincide. So therefore, knowledge base is increased as well as a preventative measure is in place. So what this looks like, the intervention focuses again on uniting community. So it will entail a collaborative effort between community health workers, which include health educators, mobilizers, volunteers, as well as traditional leaders, since they are a permanent fixture in the community. They will help foster trust in the intervention as a whole, and help encourage adoption of the intervention. So these team members will be able to unite more on a ground level, go into certain communities that are at high risk for malaria transmission, to disseminate the bed nets, as well as have an educational component to be able to discuss the purpose of the nets, be able to discuss the malaria burden, be able to discuss some of the risk factors that predispose a community to being affected with malaria, and of course some of the mitigative factors such as improved sanitation, not leaving water sources open, which does attract mosquitoes, and of course, proper utilization of bed nets, because prior interventions have shown that though individuals may have the bed nets, they may not be properly utilizing them, thus limiting the effectiveness. Some global health partners for this initiative, because it is quite an expansive project. It will require programs that have gone forth to lead the way, as well as help contribute to the items that are necessary, as well as the educational program component of it all. The United Nations Children Fund, UNICEF, it is a key partner for the procurement and distribution of LLITNs. They have been a driving force in other mitigative interventions that have been implemented in West Africa, as well as Asia, and I believe South America as well. Another global health partner is West Africa. West Africa Rollback Malaria Network, WARN for acronym, and they facilitate partner coordination on technical and operational malaria control. So they will be a key partner in terms of learning the mechanisms and the inputs that are necessary to produce this program. And of course, first and foremost, one of the main important partners that are the driving force for this initiative will be the community members. Community input ensures that the intervention and educational campaign is culturally acceptable, thus increasing adoption and usage rates. Since we are on the topic of being culturally acceptable, it is a center point of the intervention. It would definitely be ineffective to address a community and not be able to consider all the cultural factors that drive the community. So this will be a key center point of our intervention. A couple of the bullet points to be aware of when thinking of being culturally competent is understanding and adopting the preferred forms of learning based on the culture and tradition, limiting that language barrier, and ensuring that members fully understand through communication as well as written materials what the program is about and how to properly go about establishing the program. This way, it ensures that teachings about net usage are, of course, delivered in local languages, addressing specific cultural beliefs, and ensuring that it is well conveyed. It is also important to assess community preferences when it comes to color and size. Certain colors in certain communities mean certain things that can foster or hinder adoption of the nets. So it is very much essential that that is taken into consideration. And of course, no intervention is complete without methodology for evaluation, because how else will one understand or know if the implementation has been effective in the community? And we are discussing malaria, and the best way to evaluate an intervention is to assess the malaria prevalence rates in the communities that we will be entering into and disseminating this program. Of course, the prevalence rate will take into consideration new incidences, as well as any occurrences of the disease at any given point in time. We will also be evaluating morbidity rates, which will take a look at the mortality rates of malaria. And we will also be assessing the LLITN's usage rates to ensure that communities, there's an increased number of homes that are utilizing the nets as well. Of course, some of these data will be derived from health clinics, health facilities, as well as health departments or any kind of community infrastructure that is in place to track such data points. Ultimately, this intervention and this disease topic is near and dear to my heart, considering it does affect my homeland. I was never fully aware of the extent of the effect of it, but through thorough research and coming into understanding, I now know the burden that it poses on my people. So this is something that is very personal to me. It is a form of expanding my commitment to advancing health equity for back home. And it is definitely an acceleration of the eradication of malaria and alleviating its burdens on Sierra Leoneans. Of course, the goal would be ultimately to take it even beyond the borders of Sierra Leone and impacting all of West Africa and those that are heavily hit by malaria. But I thank you so very much for the time of permitting me to be able to discuss um, this disease and discuss the intervention. Thank you so very much.